For inviting me to speak on Zika. It's a topic in our office that probably is most spoke about disease than anything else. And we cover 102 different diseases for the state of Florida. So what is Zika virus? Zika virus is a flavivirus. And why is it important? It's important because the flaviviruses, dengue, West Nile, which we all heard of, hopefully, and which we've had here in Florida, can cross-react with Zika virus. So testing becomes challenging at times when we're trying to figure out whether the person truly has Zika or do they have some other flavivirus such as dengue or West Nile. It was originally found in the Uganda Zika forest by a team of researchers who were actually looking for yellow fever. They stuck this monkey up in a tree, monkey 766, how I know that, I don't know, but that's what they called it. And they went and they drew blood off this monkey every day, twice a day, trying to find yellow fever. And the researchers, of course, didn't find yellow fever. They found this new virus, which turned out to be Zika. We've had outbreaks, large outbreaks, since 2007. That outbreak was in Micronesia in the Pacific, followed in 2013 with an outbreak in the French Polynesian Islands, and then more recently, of course, in Brazil and South America.
Can we ask questions direction?
Whenever.
However, the speaker would like to, would you like to ask a question?
Just a quick one. The encephalopathy.
Microcephaly?
Yes,
yeah.
That was part of the condition, the other outbreaks as well?
It turns out, yes. We didn't know much about these other outbreaks. And we'll get to that in just a minute, why we didn't know much about them. But they went back, CDC went back and started looking at all the medical records of the people that were diagnosed with Zika, especially females. And they did find microcephaly, or the babies born with small heads, and also Guillain-Barré syndrome in some of the patients. But now we're seeing, Brazil, they've had the largest number of people infected. They quit actually reporting the numbers. Where here, of course, in Florida, we record every number. We don't have anything near the thousands that they have in Brazil. The microcephaly, as you know, CDC came out 3 weeks ago and said there is a direct link between the virus and the poor pregnancy outcome.
Does that apply to monkeys as well?
No. Thanks for asking that. It doesn't seem to affect the monkey. When they drew the blood from the monkey was perfectly fine. It never became ill. It's only humans that become ill. And not all humans, of course, that get the virus will show signs or symptoms. So it's primarily transmitted through the bite of an infected mosquito, Aedes aegypti and Aedes albopictus. Possibly albopictus. And we say possibly because in Africa, it's actually transmitted by the Aedes africans mosquito. So we know the family of Aedes is the cat that will transmit it, and we're actually guessing that this is going to be possible through albopictus. And both of these, of course, not native mosquitoes to the U.S. They were brought in, aegypti was brought in from Africa and albopictus from Asia, but they are our predominant mosquitoes here in the South and part of the U.S. It's also been documented transmission during pregnancy and time of birth, through sexual contact. There were 2 cases in Brazil from a blood transfusion. There's been a lab exposure in Brazil also. We've also detected it in breast milk, saliva, and urine, but no documented transmission. We used to test saliva because saliva was a great indicator of the virus, but we've actually stopped doing that now, and we're only looking at urine and blood.
Excuse me, Patrick, we have another question.
Oh,
quick question. So it's pretty much mostly transmitted through like mosquitoes,
right.
But could it possibly be transmitted if you eat like one of the animals that has the, or no?
It hasn't been found to.
Okay.
It's not like brucellosis or anthrax or something like that. It's not.
Okay.
I wanted to show this map. This is courtesy of CDC. This shows you the Aedes aegypti territory and also the albopictus. And this is You know, one of the reasons it's so concerning to us is that if it ever becomes locally acquired, you can see the range that these mosquitoes have, that we can have more and more people, like Puerto Rico, having this infection. And this map just shows it where in the world that they're actually having active transmission. And if you're challenged by maps, here's a list of all the countries. Here's the Americas. This list grows about every 2 weeks. You'll see 2 or 3 added to it. Oceania and Pacific Islands and Africa. Here in the U.S., we've had 426 documented cases, all imported. All right. In 36 of those 426 are pregnant, so we're monitoring those pregnant females daily. 8 of those were sexually transmitted, and if you've kept up with Florida, we've actually had 1 case sexually transmitted in Florida, and then 1 case of Guillain-Barré syndrome. In the U.S. territories, mainly Puerto Rico, there's been 599 cases. And what's amazing to me is that 596 locally acquired, that's mosquito transmitted cases. That's in Puerto Rico. And it relates back to these 3 original cases. They actually traced it back to these 3 people. And one gentleman, an 82-year-old gentleman, actually was the first. So looking at Florida, well, this is a map of the U.S. It just shows that the majority of states have reported cases of Zika, all, of course, imported. Only, I think, 7 states have not reported any cases. And when we look at Florida, as of last week, we had 15 counties represented with 94 cases of Zika, all imported, except that 1 that was sexually transmitted, and then we have 5 of the 94 that are pregnant females. And this afternoon, that number will be higher.
Margaret?
A quick question. Broward County had 15 cases that were reported in Miami-Dade.
39.
39.
Right.
Why are those numbers so high in Miami-Dade and Broward
Look at
County?
your population, the population of the county, and where they're coming from. Most of ours have been foreign-born nationals living here. There's been a few people here in Broward that we actually did the test on that came through Broward, whether it's on a cruise ship or came through by plane, just stopping over for a day. But the majority live here in Broward.
Now, if my real concern is, you say mosquitoes breed in standing water. I read your little brochure and it said even a cap full of water can breed. Now we have a lot of water, especially water retention when it comes to the interstates.
Right.
Are they being treated for mosquitoes?
We'll get to that in just a minute. Actually, we're jumping ahead a little bit, but yes. And I will jump ahead now, but what happens is if a doctor calls us and has a patient, they won't test it. There's a criteria that the patient has to meet. But once they meet that criteria and we agree to do the test, our environmental health group goes out and they'll walk door to door, hanging those door hangers, which I think were passed out.
Yeah.
These are really great. I hope everybody got one. These came from Broward County.
And there's more over on the table. They also look for standing water. If they can't dump the water out, they throw larvicide in to kill it. We also immediately call mosquito control, and they go out and they walk the area, they spray the area, and then once the tests come back, they go back out 2 more times and do the same thing over and over.
I'm sorry, once the test comes back that it confirms for those.
Yes, when it comes back positive for Zika, environmental health will go out again and double check, and then in mosquito control will go out 2 more times. And so they treat some bodies of water they cannot treat for regulations or what have you. We know that these mosquitoes really like to breed in small, like the bottle cap of water, not big bodies of water, like swimming pools. Yes, ma'am.
How do they become carriers of this particular virus?
They bit someone who had it.
Okay.
This Zika virus is, if you're familiar with yellow fever or malaria, if a mosquito bites someone that's infected and is in the beginning stages of their illness, their viral load is really high. So there's a lot of particles floating around in the system. It takes it and goes to the next person and bites them and spreads it.
Do they breed in brackish or saltwater?
Not saltwater, no. Brackish, I don't believe so. I think it all has to be fairly freshwater.
I'm sorry. I did not realize that the Puerto Rican cases were locally. So do we know when that's first started? Like what was the time lapse maybe from a foreign contracted to, or
It started actually last year, if I remember, at the end of last year. Because if you remember, Brazil started seeing this in late 2014. And then all of a sudden, it really took hold in 2015 and started spreading to other countries. And of course, it became really in the public eye because of the Olympics that are going to occur there very soon. And then it reached Puerto Rico, and then it started through the Caribbean islands one by one. We saw the same thing with chikungunya. Chikungunya originated in Asia, and it's also mosquito-borne. But we saw it go through the Caribbean in about 9 months, and then hit the U.S.
But to me, I mean, I don't mean to jump the presentation, but essentially we've been told it's just a matter of time till we have locally born illness. And then, so that's why it's so critical that we are ready to eliminate
And
as we can.
our response to this virus is very similar to the response we had for dengue and chikungunya. If you remember, Miami-Dade had an outbreak of dengue and then chikungunya. Broward had only one case of dengue. We went out that day and for about a week went door to door where the person lived in that area, trying to get blood, checking to make sure no one else had it. So we think we can do a pretty good job at controlling it, but we need everybody to work with us on it. The public, my neighbors hate me because they have all these flower pots on their patio, and I go over and kick them over after it rains. They never dump it. Of course, they're going to call the police on me one day, but I tell them all the time, you cannot have these things holding water because that's what these mosquitoes like. The mosquito, too, is a small mosquito. It's a day biter. It's not, when your kids out playing at night, the big mosquitoes that used to chase you around the yard. These are small mosquitoes. They like to bite during the day. They're aggressive, and they like the indoors. They're not the ones we typically think of when we think of mosquitoes.
Patrick, you were saying a lot of it is coming from Puerto Rico. They're having so many financial difficulties there. And I think part of it might be because they can't afford to spray probably for the mosquitoes. Can we help them in any way?
That's a good question. I don't know. I know that CDC's down there. They've been down there for many years because Puerto Rico has always been an epicenter for these arboviruses, flaviviruses. Dengue in particular, they have a CDC lab there that's doing research daily for vaccines. But the population, we have to think about the socioeconomic status of the island because a lot of people don't use screens on their windows and doors, or they leave the doors open. I lived in the Bahamas for many years, and everybody left their doors open. We didn't have air conditioning. We waited for the sea breeze to blow through, so there's some mosquitoes. We also know that, knowing 3 types of patients, right? One that's asymptomatic, one has mild infection, and one that has severe that actually seeks out care. So we're probably missing the large number of these cases in Puerto Rico. There's probably thousands of them that we don't know about.
Question. This sounds like I'm downplaying the primary threat we've heard about birth defects, but I don't mean to do that. But is that the only thing that you would call a health threat? Is this, whatever disease it is this a serious thing? Do people die from it? Or is birth defects the deal that we need to,
Well, that's
Working.
probably the major one that'll draw the most attention when you see a baby born with a
right?
malformed head. But there's other issues too with it, that when we look back at the medical records of these people in these other countries, we see that some of them still have ongoing neurological issues. They seem to get well, and then several months to a year later, they get sick again. So it's reoccurring. We actually follow, if you're positive, we will be asking to draw your blood hundreds of times until we see that the virus is no longer there. We did the same thing with Ebola until we found out Ebola could stay in the body and we couldn't detect it. Like the gentleman had it in his eye not too long ago. This virus, we've actually followed one person and found it in semen. We thought it would only last about 60 days, but we're further than 60 days now. It's still present and it's still transmitted.
Can I just follow up with one? I'm interested in how, you're at the communicable disease, say that word 25 times real fast. Are you responsible for, or is someone responsible for communicating with all of the, say, the general practitioners in the state and say, this is going on, we look for it, this are the signs, or whatever? How does that work?
What happens is, and that's part of the presentation too, I'm glad you're covering all this. It makes it easy.
Sorry.
So the Department of Health as a whole for the state of Florida,
Right, you know what, we're gonna hold some of the questions to the end, otherwise we'll never get to the, we'll be here. I'd love to speak on this all day, but, so, and I know your questions are important, so if we could just get through some of his presentation.
So do your answer yes, and we'll get to it in a second.
So
the clinical presentation-
I just want to
You
give
can,
one.
you can talk all you
one
want
point,
after.
because I didn't know that's what you can talk about, but the thing that I'm interested in, a long time ago, I was at the Commerce Department, and tourism was one of the big things we did, and I never got off of the tourism promotion bug, if you want to call it, coin a term, back then. And in this area that we live
You're a
in,
tourism killer.
it just seems to me, just from a total layman standpoint, if it ever came out that we had this disease originating in Miami, for instance, I see it as bad as, an act of war. Can you imagine if no women of childbearing age want to go to Miami or Fort Lauderdale? This is not a good deal. But that's why I was asking about what the threats are. Is it just the birth defects? I mean, that alone might be the killer, but
Well, we're gonna try to do something about it after he finished his presentation today, and that's why there's so many good points, and you're right, Paul. And that is one of the things, that's why we're really have Patrick here to discuss it, because it affects the South Florida a lot, and many other regions.
So the clinical presentation, the incubation is 2 to 14 days, and we know that it's transmissible by mosquito bite within the first week that you start developing symptoms. 1 in 5 people infected will become symptomatic. So 80% of the people will not know they have this virus. That's the bad one.
Wow.
You can have it and not have it.
That's when we talk to couples, the male might be positive or might not even know his status and travel to Brazil, for instance, and then comes back. His wife's already pregnant. We tell him to use condoms until the end of pregnancy. Why? Because if he is that 80% that's asymptomatic, he could transmit the virus to her and to possibly the baby. Right? It presents similar but milder to dengue and chikungunya, which we already know about. And the most common signs and symptoms are fever, which is low-grade fever, maculopapular rash, arthalgia or joint pain, conjunctivitis, which is redness and runniness of the eyes. You can also have headache, pain behind the eye, and some vomiting. Every one of the ones that we have tested and have been positive have had the rash and conjunctivitis. None of them report to us that they've ever had a fever.
Scary.
Of course, there is no cure. It's a virus, so you have to treat the symptoms. They typically will resolve within a week, but what we're finding now that if you do have some neurological issues, it's possible that they could come later on. And you want to avoid aspirin, and you want to avoid aspirin because if you're co-infected with dengue, there is a hemorrhagic dengue, which will cause aspirin, of course, will increase the likelihood of you bleeding out. There's also this possible link with Guillain-Barré syndrome. Now we know there's a definite link with poor pregnancy outcomes and microcephaly. And of course, there's no vaccine currently on the market. I think the World Health Organization announced it'd probably be about 2 years before we'd see a vaccine trial. As of up until Friday, there were no commercial testing. No laboratories could test. The only people who could test for this were the Center for Disease Control and the Florida Bureau of Laboratories and other state laboratories. Friday, the FDA actually gave approval for, I think it's Focus, which is part of Quest Laboratory, to begin testing. And when that occurs, I have no idea. But right now, it's again the state lab doing it. All samples have to be approved by us, really me. And we do 2 tests. We do a PCR. We do that on the blood and urine. And generally, if you're in the early stage of the illness, it'll be positive. Sometimes if we go out further past 21 days, it'll be negative, but the serology or the antibody test will be positive. So we do both these tests on now just urine and blood, where we used to use saliva also. And then we follow you until we see that you don't have any virus detected.
Well, why would the virus disappear?
Well, it's like any virus, really. It takes its time and then will go away. But, you know, some viruses like varicella and the family that varicella belongs to stay in the body forever. And they think it, you know, of course, with varicella or herpes, or monkey bee, they think it stays dormant. And now we know that varicella can be reactivated, and that's why you get shingles. But so what are we doing? On a national level, CDC issued a travel alert that recommended that pregnant females not go to these countries that are having Zika activity. They also recommended that if you're wanting to become pregnant, you should consult your doctor and possibly avoid the travel also. Now, they said that, we say that, but every day we get calls by pregnant females or their husbands saying, we want to go to Brazil, what do we do? And we tell them this, and they don't listen. And of course, you want to avoid mosquito bites. And it is safe to use DEET, mosquito repellent, on 2 years and older, and pregnant women can use it. So in Florida, what's been done, of course, you're probably all aware that Governor Scott on February 3rd signed Executive Order 1629, which directed the state health officer and the Surgeon General to declare a public health emergency in the first 4 counties. Now it's 15 counties. It authorized the Commissioner of Agriculture to issue mosquito declaration. It designated the Department of Health as the lead agency in the coordination in response to this. And it also directed other agencies, the Environmental Protection and Wildlife folks, to work together with Ag to come up with mosquito control plans. The declaration of public health emergency, that just notified the Commissioner of Ag that it's possible that Zika is transmitted through mosquitoes to humans. It also directed the county health officers, Dr. Thatchy here in Broward, to hold a community meeting, which actually the Chamber of Commerce, someone came to discuss best practice, mosquito control best practices. It also directed the health officer to create or develop an outreach program, which the door hangers, and there's some other gray envelopes back here with a lot of material that we've sent out all over the place. When they declared the emergency, it also made Zika reportable, or the suspicion of Zika reportable. So anyone that goes into an emergency room, a doctor's office, an urgent clinic, who says, I have these symptoms of travel, they have to be reported to us immediately. And that's 24 hours a day, 7 days a week. Those people are the ones that we want to test, of course. All people that have traveled to one of these areas and have developed at least 2 of the 4 main symptoms: fever, rash, joint pain, or conjunctivitis. And we want to test mothers of infants or fetuses with microcephaly or intracranial calcifications. The problem with this is you don't normally see this until the baby's born. Now, CDC recommends that mothers who test positive and mothers who have been in these countries have serial ultrasounds every 4 weeks to try to detect this early on so that the female can make decisions. And again, this is testing pregnant women who have traveled. And then we want to also look out for the symptomatic persons with no travel history but may live with someone or had sex with someone who's traveled. And of course, we look at the ultrasounds too, trying to detect microcephaly. It also directed hospitals to notify us on a 24-hour basis of any person that's hospitalized. The question is about hospitalization in this. It's rare to be hospitalized with this. Very rare. I usually find out about pregnant females when they're delivering at Memorial. That's usually when they tell me. Death is even rarer. But you probably read in a paper last week, we did have our first death in the U.S., and that was in Puerto Rico. So once they notify us or ask us to test, we start doing things in our epi office. One is, of course, that we arrange to get the samples to our lab and get tested. We interview the patient. We notify environmental health to go out. We notify mosquito control to go out. And then we report it up to our central office in Tallahassee, who notifies CDC of the additional case. So you're asking about what's been done. The Department of Health as a whole has targeted with guidelines hospitals, the American Congress of OBGYNs, or ACOG, midwives and nurses. They're working with their internal and external partners, and we've increased syndromic surveillance, looking for Guillain-Barré syndrome or microcephaly. And I don't know if you're familiar with syndromic surveillance, but this is where we sit in our office and we can monitor every chief complaint in the hospitals here in Broward County. Every county has the access to this system. It was actually developed by Johns Hopkins for the military to detect bioterrorism, but we use it now to look for outbreaks and indicators of possible outbreaks. Again, the response is very similar to dengue or chikungunya. We stay in close contact with mosquito control. We have a person, her sole job is to do surveillance in Tallahassee over these arboviruses. And of course, we provide education to the public. Locally, here at Broward County, we have distributed millions and millions of palm cards, flyers, posters to everybody that would take them, some that wouldn't take them. Some Publix, there's 100 Publix groceries in Broward. How do I know that? Because they took a lot of this information and we're going to pass it out when they bagged your groceries, but I've never seen it in my Publix. I ask them every day I go in there. If you go to Walgreens on 84, you will see it, but it's at the customer service desk. But we've blanketed the whole county. We've sent this material to Jamaica. They requested it. We've sent it to Miami, Palm Beach, you name it. They have it. And the main message is, of course, mosquito bite prevention is drain, cover, cover. Drain standing water, wear long sleeves, long pants, shoes and socks, and use repellent to keep you from getting bit. And these are just examples that are in these packs over here of these posters. Now, with the hospitals here in Broward, we actually went out, which we do on a regular basis, and we met with the emergency department directors. We meet with the CEOs of a lot of the hospitals, and we talk about, what their plans are, what they're doing to help us with this problem. We did the same thing for Ebola. We did it for dengue. We do it every time a new disease comes out. We're in the 17 acute care hospitals. They also got packets. They have big posters. They also, this whole packet was actually mailed to all the Broward County physicians that are listed in MQA's database. They also went to all the urgent care centers, EMS, federally qualified health centers, retail pharmacies, and volunteer clinics. And we also, of course, are on call 24 hours a day for any questions. And environmental health, of course, goes out and does assessments. We work with the EOC with this. And of coordinate with Broward County Mosquito, which I think they hate us because we've gone through their budget very quickly. So with that, if you have any questions?
I think Mario has one for you, Patrick.
So, is there a certain stage in pregnancy that that women are more susceptible to getting the virus, or is it throughout the entire?
Well, it can be throughout the entire pregnancy that you could get the virus, but it looks like that it's in the first trimester is the worst time for that fetus,
Okay.
because it has more time, of course, the virus in the body to develop other
One quick
problems.
follow-up. If not, could you possibly share your presentation with the?
Well,
We're gonna put it on the
Yeah,
website.
we're gonna put it on the web, and I'll send all of you a link.
And one question, Patrick, and Margaret, I'll get right to you. We have something here that the Senate would not fund this anyway so far. Is there something that we could do from our council that we could write, bring a resolution for Congress to fund,
That's fine.
like some type of funding source for the Zika virus for protection?
Council members, this article's in your meeting package and the supplement you received this morning that provides an update on sort of the conversation going on in Washington about funding the back and forth that's going on. They haven't reached
Any
solution
agreement?
yet.
As a state employee, I can't really comment on that.
Yes.
We'd like it to happen, but we really can't comment on anything to do.
And maybe we'll see if we can get a vote or somebody would like to make a motion to.
Move that, very important.
I will
Very
second
important.
that.
Do I hear a motion on that and a discussion?
Well, I'm certainly in support of this, but I was going to bring up another aspect of it. I don't, maybe if it's so okay, I'll just bring it in and see if we want to add it or not.
Sure.
We have a resolution coming forward in Miami Dade in support of efforts, and obviously.
Oh, good. I would agree with that.
Yeah. The challenge is that we don't currently have the ability to go into property where they're not taking these measures. And I understand that in Monroe County, they have that in place. And of course, there are concerns about issues of privacy and the like. But in a health emergency of this sort, you know, it's pretty apparent that, you know, I could do everything and my neighbor is doing nothing and I'm just as vulnerable. So what are the position, what's the position of the Department of Health on this? The fact that it's been declared emergency by the governor, does that in any way allow us to take further measures? Our county attorney's office is being very conservative in interpretation of what we should do.
They should actually speak to our legal office, because there are legal remedies to allow you to go in. We've never had anyone tell us, no, you cannot come on our property. Once we explain it, mosquito control's with us, we have environmental health, they've never said no. I know that some people in the future probably will, but there's legal things that we can do. Another one's code enforcement. When we had the dengue case here in Broward, we went door to door in the entire area. Myself and two of my staff members with environmental health and with mosquito control, and we found houses, abandoned houses, houses on the market that had swimming pools that had water standing in it. And we picked up the phone and called code enforcement. They came out and we said, you know, this is a hazard. Can we larvicide it? And they said, yes, go ahead and do it. But we've not been stopped yet.
That's Margaret and then Sandra.
One of my concern in trying to be proactive, and I don't know how you do that, and I know in your
Turn the lights
present.
back on back there.
Pardon me?
Okay, I'm sorry, we're just trying to turn the lights back on.
In your presentation, you said women of childbearing age are more susceptible to this disease. What about senior citizens that have poor health, or that? My thing was, I'm a senior citizen, so I'm really concerned about.
Well, we're all equally, we can all equally be infected. And just because you're female childbearing years doesn't put you at greater risk. What it does, though, is put your baby at greater risk.
Right.
Right? So, in the idea that I'm a female childbearing age really doesn't really matter. It just matters if she's pregnant. For the elderly or older adults, Yeah, there is a problem with that because they usually have comorbidities, other issues that puts them at greater risk of having problems when whatever insult comes their way. You know, the key message though is to go out and make sure there's no standing water, make sure you don't get bitten by a mosquito.
Okay, one of the things that you just said in your presentation is to cover up, use mosquito repellent. Well, we live in South Florida, and in July, I don't want to go outside in long pants and long sleeves. So, I understand
Might
the
have to.
different ingredients, pardon me, the different ingredients that you need to look for when you buy an insect repellent. How, I still don't see how that can help avoid this.
Where the lump
Not necessarily avoid it,
That's what
but
dress like we're in Africa or somewhere, you know, just wear pants and.
Whether
Like-
people, you know, you bring up a point, and whether people realize or not, you know, to be inconvenienced for a little while by wearing long pants, long sleeves, beats having this infection. I had this same conversation with a mother over the weekend because her child had meningitis, and we wanted her to take one dose of Cipro, 500 milligrams, swallow it, you're done. And she wanted to debate it with me, and I said, you know, one pill that's free or death. Well, we know that death's rare with this, but, you know, wear long sleeve, long pants, or use DEET, or get infected. Whether we will have this locally acquired here, I hope not. If our response is as good as it was in dengue and chikungunya, I doubt it. But, you know, you have to weigh the odds yourself. I mean, I don't like wearing neckties and wearing things around my
We'll
neck.
spray you.
But I do it, yeah. But we do. We give cans of spray out to all our staff that are in the field. Now, I don't spray myself when I get home and go out and kick my neighbor's pots over. But I make sure there's no standing water. You know, there's things like that. But the whole idea is we need to get the message out about the standing water. I would love it if the cities and their municipal workers who are in the field would be our eyes also, because we can't do it ourselves. I have a group of 80 some odd staff members that work for me. Only 4 of those are dedicated to this. And there's another 102 diseases and conditions that we're responsible to follow.
Okay. I'm going to take Sandra and then Commissioner Furr.
A couple of things. Regarding access to the property, I'm somewhat familiar through what I do for a living, and it is my understanding that code enforcement has access when it's a threat to public health and safety.
Right.
They are not allowed, when they make such access, to use the information that they might happen to see for any other purpose than the specific purpose they're entering the property for. So if people are concerned that for whatever reason, they might want someone to come on the property, they can be assured that they're not going to get arrested for something else. You know, it's very specific. And one thing that I believe is the case in Monroe County is that garbage cans have to have holes in the bottom of them. Because we have a lot of snowbirds that, you know, have a yard care service that does their yard work. And it could be a week or two between when the trash gets picked up and when the containers get removed. Now, in my neighborhood, I think all of us have a tent. We turn them all over when we see them when they're sitting there for a long time. But I think it's an important thing to address because, let's face it, if garbage, you know, when they collect the garbage, at least up here, many of the services have covered lids that they put back down again. We're not so lucky in a lot of cases in Monroe. Particularly the yard waste, because those containers are typically put out with the lid off. And so if they're thrown back and they're not upside down, they're collecting water in our rain. And I think if there's any community that doesn't have a requirement that all those containers have holes in the bottom, they need to. Because that's a big threat that could sit there for weeks. Yeah.
Thank you, Sandra. Commissioner Furr?
Those are good comments, I appreciate it. I just need clarification. Did you say this is a, once someone is infected, is it can it remain dormant, or can it actually go away?
Well, for most people, it goes away. But
Okay.
what they found in these other outbreaks is that some of the people were still experiencing neurological issues. If they had a neurological issue in the very beginning of this illness, then they would, somehow it would come back and they would have other issues down the road. In particular, there was a couple of cases where there were older gentlemen who developed Guillain-Barré syndrome, which is neurological. They seemed to get over it, and then several months to a year later, you start having issues again.
So the virus might be gone, but the
side
symptom
effects
is
still
still.
could be there.
I think that's important to know, though.
And
Yes. Did you want to say something? Yes, please.
So, Mr. Jenkins, it occurs to me that a real logical venue for helping to distribute this information would be the Postal Service. And I don't know if the department is working with them, but they walk door to door every day.
we
So I
haven't,
think that would be a
but,
good way to
I
run
think
it.
in other outbreaks, we've approached them, but it never went any further than that.
Well, maybe that's something that we could put in our letter to our congressional representatives, suggesting that they deploy that, because that's an easy hit.
Right, and that they can afford.
And then, right, you know, and then the other thing that, I'm wondering if you have these materials in a PDF form that could be distributed to our cities and counties, so it could be put out there
For our water
as at
bill,
least
right.
one venue of getting the information out there.
I believe that, excuse me, I believe our PIO did send some of these things out. I'm not sure about the door hanger, but
It seems like a digital format that ease, you know, transmission of the information.
They have them.
a lot of these were sent out by electronic. These posters, which is basically also the door
Well,
hangers.
we maybe can get some of these and then put them on the web and get it out to our cities all over so that we can spread the words.
If you call our PIO, Candy Sims, she can get it for you. Or Bob Lemondola, some of you might know
Oh,
him
he used to be the
from.
Sun Sentinel, didn't he?
Yeah, he used to be at Sun Sentinel. We acquired him, and very happy with that. But
And
these all have been sent out
He
electronically.
said Cindy.
Her name is Candy Sims, S-I-M-S.
Thank you very much.
Phone number?
Follow up with you.
Oh, that's a good question.
What's her phone number?
Let's see if I can find it.
Well, you've been so informative. I must tell you that this was a great presentation today. Something that could affect everyone. You know, prevention is better to know about it ahead of time than wait till we get an epidemic going here. So we'll get that phone.
So we're gonna vote, we didn't vote. right?
Yeah, yes, I'd like to vote on sending a resolution to Congress on having some type of funding. for
Urging
this.
them to move.
Or getting them to move on it. Do I get a second? All in favor?
Should be directed to our representatives, right, I guess?
And our
Great, thank you.
senators, right?
I think it's important that, from what I read in the papers, most of our representatives are already on board with this,
And our senators
sure
as
they
well.
Democrats and Republicans.
I'm sure this is not a, it's not be a partisan, it's not a partisan issue here. But anyway, I'm gonna get that number.
I'll give it to you. This is probably her cell number, and she'll kill me, but she gives mine out to everybody, so it's okay. I believe it's 954-895-5745.
954-895-5745.
5745. And her other number, which might be her home, but that's okay, we'll bother
Well,
her.
I don't think she wants us all calling her, do you?
954-651. 651-2950. And if you have problems, you can always just call my office. And
Do you have a number for Mr. Lamondola? That's all right, we'll figure it out.
And if they get a lot of phone calls, they'll be blaming you, Patrick, for giving their numbers up.
That's okay, my boss, Dr. Thatch,
Well,
has
first
put
of all-
my phone number everywhere in the county, so.
Thank you so much for being here, and we really appreciate it. All right, to continue on here, we're going to go on to the next item, which is going